Hi everyone, welcome back.
Hi everyone, I'm Duo.
And I'm Joy. I hope you remember us from the previous days. And Duo, I'm happy to see that you're also wearing orange.
Yes, I am. Tell me why you are also wearing orange. I'm curious now.
Because I feel like it's our talk show, or I feel like I'm joining an awards show.
Oh, really? But I don't think it's gonna be only an award ceremony, right?
Yeah, that's true. That's true. So today we're having uh the presentation of our APPIS Innovator Program finalists. And I must say, this is really one of my most awaited parts of this year's APPIS Summit. And it's the maiden year for the Innovator Program. It's an initiative that was born out of a desire to really identify and partner with patient organizations that have innovated the way of elevating and amplifying patients' voices. And for me, the Innovator Program really exemplifies the essence of APPIS because it truly stands for alliance and partnerships for patient innovation and solutions.
Yeah, and also actually some people actually asked us before, right? Is it an award ceremony? Is it a recognition? I would say not entirely, because an award ceremony, you just get trophy and you go, let's just see you next year. But we don't want that for the APPIS Innovator Program. And some people also asked us whether it's going to be an incubator program. I would say not entirely either, because what we're looking for now are patient groups that are already making huge impact on the ground across Asia Pacific, Middle East, and Africa. So with the support from the APPIS Innovator Program, our aspiration is to elevate the great work they've already been doing. So it's more like a recognition plus incubator program, two in one, right, Joy?
Yeah, it's so many things wrapped in one. And I'm really pleasantly surprised when we opened the floor for submissions. We really did get a lot. We received more than 20 entries from across 11 countries, representing our different geographies in the region. And it also covered the various disease areas from cancer to cardiovascular disease to diabetes and also psoriasis and so many others. So it was really not an easy task to shortlist all of these amazing submissions to just 5 candidates.
Yeah, and it's great to see they all cover, as you mentioned, all the most critical unmet medical needs across the region. And then actually for this innovator program, we do have 2 categories. The first one is patient education, which is inconsistent with our day 1 theme, health literacy. And then we also have another category, health policy shaping, which is the day 2 theme. So actually, in order for all the initiatives to be fairly evaluated, we have actually established a beautiful lineup of our lovely expert panel for the Innovator Program, which I believe that you will see them on the slides first and they will appear live. So first, actually, as you can see on the slide, we have Ching, who is the region head for Asia Pacific, Eastern Europe, and Central Asia from the Max Foundation. I personally spoke to Ching only once, but her passion actually was really contagious. And thinking of the Innovator Program being an initiative that is aiming to drive impact, I think Ching is really great to have you here. And also, as you can see, we have Professor John Lim. So for those of you who joined the second day session of the APPIS Region-Wide Summit, I believe we all definitely must vividly remember the very insightful keynote speech by Professor Lim, which is really about, kind of elevating patient engagement in shaping health policy shaping. So I believe Professor Lim is the best fit here as well. And then last but not least, we have Li Tiantian, sorry, or Stanley. So actually, Stanley is a digital health innovator and also the chairman and founder of DXY, which is the largest physician social network, as well as consumer-centric digital applications and services focused on lifestyles and preventions in mainland China. So what do you think of our panel, Joy?
I think we can't have better set of panelists sitting with us today. I'm very also excited to hear what they have to say for the amazing initiatives that we will be hearing in a few minutes from now.
Totally. And also, in addition to the panel, right, we also would like to get the audience involved, which is why I believe all the participants in the Innovator Program hall right now, as you can see at the bottom part of the screen, you have 4 functionalities. Actually, we encourage you to give your heart. Remember, only the heart, not the thumb up, not the stars, not the hand clapping, not the hugs. I don't know whether there's a hug.
Just
Yeah,
the
yeah,
heart.
like Joy showed, there is a hug. I can't do that. So, so let's make sure we, show our appreciation and show our encouragement. Let's cheer for all the finalists today, and also for all the great work that has been done across the region. So, shall we have a video, Joy, to...
Yeah, I think now is the perfect time to showcase all the amazing initiatives that we have received. And so Neil, can you help us show the video, please?
Thank you.
Thank you so much. So without further ado, I want to introduce you all to our first finalist. And I'll give a few teasers. So this finalist is from India, and it comes from the patient education category. I'm very excited to present the Blue Circle Diabetes app from the Blue Circle Diabetes Foundation, to be presented by Ms. Nupur Lelvani. Ms. Nupur, the next 10 minutes are yours.
Hello, everyone. Good afternoon. Thank you, Novartis, for this lovely 3-day event. My name is Nupur, and I have lived with type 1 diabetes since I was an 8-year-old child. I founded the Blue Circle Diabetes Foundation, which is India's largest patient-led community for all types of diabetes. We are also a registered NGO, and we work in diabetes awareness and advocacy across India. What you see on the screen right now are some of the organizations that we have collaborated with. Our team has people with lived experience, expertise, and a diverse range of skills, right from engineering to data analysis, and from community building to advocacy. People with type 1 diabetes inject insulin 4 to 6 times a day. This is the syringe that I inject myself with, and we test our sugars on glucometers and wearable monitors. Next slide, please. The scale of the problem that we are faced with is massive here in India. We have 80 million diabetics, and just to give you a perspective, that is roughly the population of the whole country of Germany. To add to that, there is a very stark divide which demarcates the urban and the rural healthcare. What you see on the screen is just a slice of the problems that are faced, right from language barriers to the lack of developed health infrastructure and a very skewed doctor to patient ratio, which obviously leads to time constraints. There's an obvious lack of community support as well, and very limited to no focus on mental health, even in the urban areas. Chronic physical conditions like diabetes take a huge toll, not only on the mental health of the people who are living with diabetes, but also on their caregivers. As you can imagine, other than affordability in a low and middle income country, there are many socio-cultural problems as well, like stigma, language barriers, and more. Next slide, please. Thank you. Now I'm going to talk about our Blue Circle Diabetes app. Next slide, please. Which is an app made by diabetics and for diabetics. Now, diabetes is a data-driven condition, and what you cannot track, you obviously cannot treat. The Blue Circle Diabetes app now has 22 million blood sugar records and counting. We truly believe that technology-driven healthcare has the power to bridge the gaps in the current healthcare system. So a little background here, there are tons of apps and tons of diabetes apps in the market, and most are focused on the West or are very commercial ones that need the patient to be able to pay to use them. The situation or the challenge here is that diabetics often do not log their diabetes data. So what kind of data are we talking about? We're talking about blood sugars, food, exercise, medication, which could be insulin or oral medication. Logging is very essential to be able to then extrapolate the data, analyze trends, make intelligent improvements, discuss with your medical professional, and lots more. In this age of technology, many people still use pen and paper. Now, not only is this time consuming, but it's also not environmentally friendly or convenient. The issues and challenges that we face here in India are truly unique and cannot be compared to the West. What better than an app that is put together by people who are living with the condition themselves? Who better than them to know what is really needed and what would make the lives of people with diabetes easier to manage? So what you see on the screen right now are a few snapshots from the app, the home screen, the screen where you can enter your meal for the day. And also on the top right, you can see a reminder that people with diabetes would get if they're using the app, a reminder to test their blood glucose. Next slide, please. So we began with a blank slate and we let our diabetic beta testers get really creative and tell us what they really wanted in their ideal diabetes app. So we looked for features, we tested for bugs, we did a lot of back and forth, and in fact, seeking feedback from our users is something that we take very, very seriously. It is something that has worked wonderfully for us. Our users suggest new features and improvements in the app, and we track each request that comes in. And we eventually, based on the majority requirement and the urgency, we then incorporate these features into upcoming app updates. So what you see on the screen right now is a plate of food that a person living with diabetes has eaten, and you can see their sugars before as well as after the meal, which get picked up by their CGM. You can see the macros of the food, the carbs, proteins, fats, and the other details. What you see on the right is a mock-up of a report that gets generated by a user after using the app. So the current features of the app that you would have seen on the screen before as well are not only to log your insulin and your exercise and your medication, but also to be able to sync the app with continuous glucose monitors, reminders to check blood glucose, being able to add followers who can track your sugars in real time, generating reports, calculating your sensitivity factor, your carb ratio, your HbA1c, your time in range. We also have a section on nutritional information where families can look up the carb, protein, and fat content of various foods. We have a lot of users across various countries, and we not only show blood sugars in mgdl, which is used here in India, but also in mmol. And we also have access to the Buddy Project helpline, which I'll touch upon later. Next slide, please. Thank you. So thousands of people and families with different types of diabetes across the globe use the Blue Circle Diabetes app. Our users, like I was mentioning, are not just from India, which is not surprising because the app was made originally keeping the sensibilities of the Indian users in mind, but we also have a lot of European users. In fact, the MMOL feature really came about thanks to a lot of requests that we received from European diabetics as well. Now that, let me give you a quick example. So now that physical schools are reopening, lockdown is being rolled back and schools are opening here in India. Parents are beginning to use our app to remotely track the blood sugar of their children, of their school-going children. Now, you must note that there's been a 2-year gap. A lot of children have been diagnosed with type 1 diabetes in the last 2 years. A lot of them have had, they've been diagnosed earlier, but there's been a break. So this is really something that makes the parents' minds at ease, that they're able to track their child's sugars. So this is a real life example of how the app is useful. The app also shows you the estimated HbA1c, which is something that has been reported to be an extremely useful tool that helps people with diabetes stay on track. We now have more than 22 million blood sugar records and counting. And with the right kind of support, we could take this app to hospitals and medical centers, and we could work together with the local healthcare providers so that patients can not only use this app, but also work along with their healthcare teams and be benefited by the app. We could also work with areas in R&D to be able to understand the impact of logging that occurs on people's diabetes management. We could then publish research papers about it, especially in the South Indian and the South Asian context, since this narrative mostly exists in the West and it's really missing in this part of the world. Next slide, please. Next slide. Thank you. So I'm going to now quickly spotlight a small feature which is there in the app. It's called the Buddy Project Helpline, which is available on the Blue Circle Diabetes app. It's a free diabetes and mental health helpline. And what's special is that this helpline is run by trained people who have lived experience of diabetes and who speak 7 different languages. So this is India's first psychosocial diabetes and mental health helpline. It is on the Blue Circle Diabetes app, and it's got trained people as well. So in interest of time, I'm going to now wrap up just by saying that mental health is much ignored for people who are living with physical conditions. And COVID has created a lot of distress and anxiety. So not just the app, but also the helpline together is something that we really, really have built from ground up and would love to nurture. It's a peer support and learning project where diabetics and their families can share their thoughts in a non-judgmental kind of space. So with that, I am happy to wrap up and answer any questions that you may have. Thank you.
I can't believe I was on mute. Thank you, Nupur. That was really amazing. And I love how intuitive the app is. And, you know, it's not just really about, it's not for diabetes patients, but it's also made by diabetes patients. And audience members, if you love this app, please don't forget to show your love by clicking that heart icon that you can find at the lower part of your screen. At this point, I'd like to call on our expert panelists. So we can give them some time to ask Nupur some questions and also to provide their comments.
Hello, Nupur. Thank you very much for your introduction. Here is one question. We all know in the therapy process, there must be some dropout patients, no matter what kind of reasons. And I'm quite sure your service, there could be some dropout patient. And can you share with us what is the major dropout reason among all these patients?
Sure. Thank you so much for your question. So we've noticed that the lack of a community, and if I understand correctly, what is the reason for dropout? And I think the major reason is that there's a lack of continued and sustained support. People meet doctors maybe once in 3 months or once in 6 months, but really you're self-managing your diabetes in between of those 90 days. So what you do in the 90 days is more important than just meeting the doctor for 15 minutes. So we have very active and vibrant community where we motivate each other and we support each other and we help people stay on track and remind them to log all their data.
Thank you.
Thank you.
Hey, thanks, Nupur. This is Ching. Hey, first, congratulations. I'm really amazed with this because it's really come from the patient. I think that is probably the one thing that you're most proud of. So I do have a questions that follow up questions from my panelist colleague. So you're saying is like one of the key dropout rate is because of the engagement, right? And the supports and all that. So my questions to you would be, diabetes is a chronic kind of like a long-term diseases. You need to work with your healthcare providers, and you need to work with your caregivers, and also of course probably your peers to really have that support. So in your presentation, I don't think I really hear about you say a lot about the physicians engagement or healthcare professional community engagement. Can you kind of like share a little bit with us, like when you have these apps, what is the involvement towards with the healthcare professional groups?
Thanks so much for your question. Thank you for asking me this in particular. Because of lack of time, I wasn't, able to put in the whole picture. But with physicians, we did, take the feedback of some physicians while developing the app as well. Though it was primarily built by and for diabetics, we did sit down with some of the physicians and take their feedback on what parameters are they measuring when they see a patient every 3 months or every 6 months. And together with the patients, then we developed the app. The patients are also encouraged to spool reports and generate reports from the app and email their doctor. So that is something I know that a lot of patients are currently using. So that's from the physician side. And from the community side, we have across various social media platforms. In fact, particularly on Facebook, we have a very vibrant community of over 8,000 people on our Facebook group. And we've also been selected for the Facebook Accelerator program. So that really helps us keep in touch with our community, irrespective of geographical location or any other barriers, such as in the last 2 years, even COVID. People are able to stay in touch and share their readings and share screenshots of the app. So that hopefully keeps them motivated. Thank you.
Well, Nupur, can I add my congratulations to my fellow panelists? It's an amazing app. There's so many apps out there. And I think similar to what others have said, I was very impressed by the fact that it was basically ground up from a blank slate. I think one thing that struck me in particular was you said it was very culturally specific for India initially. And then you said you've extended it now to many people, let's say even from Europe. So I think that's very important because it needs to be culturally specific. And I'm just wondering, is the context quite different? Because you have several million records now on the app. But a bit following on from the last question, how do you sort of manage this sort of follow through in terms of users interpreting and applying whatever they are getting from the app? And then in terms of connecting with healthcare professionals, because there seem to be so many users, so much information, but it's not totally clear to me how you streamline that. And that's extremely important for patient follow-up, right, in terms of chronic care.
Absolutely. Thank you for your question. And I think I would begin by saying that we are quite a work in progress at this point. The goal going forward in the near future is to be able to formally, track the impact and the benefit the app has had on the patients. As of now, we have a lot of anecdotal evidence, people sharing screenshots of their HbA1c 6 months prior and the latest one, and saying that I've been logging my sugars and I've been sending my reports to the doctor, and I know it's helpful. But I do understand that we need to, going forward, really do a formal study and work with healthcare professionals to be able to have a scientific paper or a research or a backing that also shows this connection that we see happening in real life every day. I hope that answers the question.
Thank you.
Thank you.
Thank you
Can
so
I have
much.
one more question? So,
Yes, please.
is it time's up?
No, we have time, Ching. Please go ahead.
All right. Yeah. So back to the very basic questions. The apps is to be built up for communications, to kind of engagement and all that. So you started with saying that language is a barrier. So what is the language that these Blue Circle Diabetes apps mainly build up? Like
So
English?
Yes, the app is currently only in English, and we would need support to be able to, get people who are experts in not just medicine and science, but also language, and bring all of these people together to help us really have the app available in local languages as well. So on a really small scale, what we do on our YouTube channel is that we have videos in around 10 to 15 languages, on how to use the app and on how to do the basics of diabetes management. But this is something that we need support with to be able to scale it up and include more languages. Thank you.
All right, thank you. I think you're trying to tell us like why you need to be chosen as a winner, right? Thank you.
Thank you for your question.
Well, thank you so much to our panelists. And again, big congratulations to you, Nupur. With or without winning this, you're already a winner. And Duo, where are you? Can I ask you to please introduce our next finalist, please?
Sure. Can everybody see me? Hi. So thank you so much, Nupur. I don't know how many hearts you've got in the hall, but I do know you've kicked off the entire innovator program really in style. So congratulations. So next up, I'm not gonna review too much, but I would say, because I don't want to sound biased, sorry. So next one actually is a bit different, right? So actually from the total of 23 high quality submissions, we only have 4 falling into the category of health policy shaping. And then the next program is one of them. So with that, I'm going to hand over to Tamana from Takashima Health. Over to you, Tamana.
Thank you so much, everyone. Thank you so much, Devo, for the introduction. So good morning, good afternoon to the respective judges, finalists, and delegates who have joined us today at APPIS 2022. I am Tamana Sachdeva, working as Manager Projects at Takashima Health. And it is an honor to be named as one of the finalists at APPIS Innovator Program. And it is a pleasure to present our initiative, the Stroke Support Alliance, led by Takashima Health. A brief description about my organization. Takashima Health is a not-for-profit organization established in 2012, and it aims to bring a change the way the health is perceived and delivered in the country. And also it strives to bring all the survivors and caregivers on the one platform and make the healthcare accessible, safe, and within the reach of the person who needs it. Other description is already displayed on my screen. So just want to end that as we achieve our vision and mission by collaborating with various patient organizations and also assisting them in development of the capacity so that there is an increased awareness and they can better manage the condition. Next slide, please. Talking about our initiative today, that is Stroke Support Alliance, which is dedicated towards the 4 broad categories, that is policy shaping, information and awareness, capacity building, and as well as health system strengthening. So basically, by the Stroke Support Alliance strives to bring all the survivors, stroke survivors and caregivers on a common platform so that they can raise their issues along with the healthcare providers. Next slide, please. We do this by 3 levels. At the policy, survivor, and caregiver level. At policy level, we consolidate all the patient and caregiver voices so as to contribute in establishing a care continuum pathway for stroke, irrespective of their economic and geographical circumstances. At survivor and caregiver level, we wish to raise awareness about the stroke, how to manage their condition, and also with an integration of various channels into comprehensively, easily available resource for the survivors as well as caregivers to manage their rehabilitation, consistent follow-up, and recognizing the danger signs for the second stroke. Next slide, please. So today, my pitch would actually be focusing on health policy shaping. That is one of the category today. Next slide. There are very few stroke support patient groups in India, and some of these patient groups that are present are either fragmented or either led by the physicians in the country, basically on the awareness or to manage their medical condition better. Talking about the current scenario, you might be astonished that 1 in every 4 persons over the age of 25 will have a stroke in their lifetimes. And it is the leading cause of disability and death. Talking about India, every year approximately 1.8 people suffer from stroke. Yes, there are some guidelines for stroke prevention and management that has been released by Government of India in 2019, but it's mostly focused towards the hospital-based and doesn't cover the care continuum part for stroke. And talking about the treatment within the golden hours, less than 1% of India get the treatment within golden hours. It is evident after seeing the 100% increase in the incidence of stroke, there are some systemic problems that need to be addressed with a more focused approach. That's why we felt the need for the formation of a national alliance like Stroke Support Alliance that intends to bring all the survivors, caregivers on a common platform to raise their issues, raise their voices, and to explore the opportunities that might influence policymakers as well as the healthcare providers to build a better healthcare system. We do this by including the patient voice in national stroke guidelines, including the measure for financial risk protection for stroke, and considering stroke as a care continuum pathway rather than a medical emergency requiring a surgery. Next slide, please. Now, I would like to present the impact of Stroke Support Alliance we have over the past 1.5 years. I would like to summarize in 4 buckets. Next slide, please. First, that is policy and advocacy. We have held a series of regional and national consultations with more than 40 stakeholders in stroke ecosystem, as well as with the patient advocates. And we have also developed a policy recommendation paper, and some of the outcomes are already listed on my presentation. That is inclusion of neurological packages in the Ayushman Bharat initiative that is being led by government of India, as well as the acceptance of the integrated treatment protocols for the stroke in like palliative care. Also, we have been requested by the government to design an operational guidelines for the palliative care in the partnership with the other agency. Also, IRDA has been requested to include stroke as a unique category under the private health insurance. And this has been acknowledged by them and currently in process. Moving on to outreach, we have outreach to over more than 160 plus organizations from public and private sectors, hospitals, 32 stroke-ready hospitals, as well as we have many other professional organizations. We have conducted over 826 webinars, and we have 800 plus webinar registrants, in which there were 500 plus stroke survivors and caregivers, as well as the other stakeholders in this category. Moving on to the patient advocacy, we have 8 patient advocates. We have done the training and capacity building, and they have even participated in the global summits and other events, and they have shared their lived experiences. They have written letters to various health officials presenting them what they need and what are their demands. We have developed 16 plus survivor stories in the video format and created the national support groups. We have variety of blogs and stories for the resources for the stroke survivors and caregivers to better manage their conditions. Not only this, we have conducted an open house meeting named as Chai Par Charcha with them so that they can better engage with themselves and learn from each other. We would not focus on awareness. I've already focused in my previous slide on how we have developed pamphlets and brochures and different other materials and resources for the survivors to better manage the condition. I would go to the next slide, please. This is the depiction of what I have talked about in my previous slide. Next slide. Next slide, please. So we consider our project to be innovative as we have looked beyond the run-of-mill interventions. Our multi-sectoral collaborations and partnerships have bring all the stakeholders under the one umbrella from different private and public sectors. Also, the stroke advocates who are itself working as a neurologist who have experienced stroke in their one's lifetime. And also, we engage them so that they can come at one platform under the one umbrella and engage with through their ideas, through their points of views to have a constructive policy change around. This is the first pan-India support group, and other 4 state-level subgroups are in making. We are also currently working on integrated care continuum pathway, palliative care packages in Ayushman Bharat scheme, and some of the recommendations have already been accepted. We have exploring a sustainable model in the CRO region, also by the different implementation models from different states that can be constructed into a feasible model and can be adopted by various states. We have also explored a telestroke model for delivering the timely access treatment at the remote areas through various national and regional dialogues, so that there is a feasible telestroke model that can be adopted by various states for the timely access to the treatment who are actually not receiving it. So through our various the whole initiative that we are talking about, this whole initiative is patient advocate led and executed, and our patients and caregivers drive this program to deciding the events, the events as well as the concept, the material, and also they guide us that what actually we need to focus on at the time of the implementation. Next slide, please. We think that we are sustainable because, next slide. Our aim is to strengthen the present patient group and forming an Asia-Pacific alliance for stroke survivors and caregivers. Stroke survivors, we have seen they have been struggling with the information on readily available stroke-ready hospital and nearest rehab centers. Therefore, we are planning to have a unified platform where all the home healthcare services, stroke-ready hospitals, nearest rehab centers, database for the stroke survivors can be built up. Also, as I mentioned, that less than 1% of the stroke patient reach at the time of the treatment to the stroke-ready hospital. So it's very important to understand that we have to find out who are the first responders, like ambulance drivers. So training of these kind of an ambulance drivers and first responders on stroke and emergency management is very, very necessary. A scalable stroke model for raising awareness among society and other caregivers that I have already talked about. And adoption and advocacy at other states and other level, I have already talked about in my previous presentation. So at the end, I would like to sum up that quality of care benchmarks need to be built up for the stroke so that it can be adopted by various organizations and various regions on the stroke. And we believe that managing and reducing the disability that will lead to increased productivity and the value of the patient group, and as well as the patient voices will add more value to what actually the current national policies are and the current national program that is in place. And the voices of these survivors can strengthen the national response and will find the recognition with all the stakeholders and support amongst the other different stakeholders. Thank you so much. I would like to end my presentation. Open for the questions.
Thank you so much, Tamana, for sharing. It's a very compelling story, and especially the impact that the beautiful work has made within less than 2 years' time. And also, I really like the sustainability plan, which means there's a chance to elevate and scale up the great work. So with that, I would like to welcome back our dear expert panel members, and I'm sure you have questions for Tamana and also the work.
Yes, yes, Tamana, thank you very much for your presentation. Actually, my father died from a stroke when I was 3 years old. That was about 1978, I think. It's pretty early. I almost have no image about him. But I do believe your work is very meaningful. But I do have one question about how do you measure your outcome? Is there any matrix you are using to measure your fantastic job, like in terms of moralities or disability rates you have observed from the patient side? Thank you.
Yes, definitely. We have several patient group. We have a national patient group where we have engaged more than 250 stroke survivors along with their caregivers of the 250 stroke survivors. So we have been able to have the interviews with them, understanding that actually what are the pain points that actually needs to be documented and what are the pain points they were actually looking as in the healthcare system that needs to be more managed. So seeing their disability, seeing their how they were not able to access the treatment at the time of when they got stroke, because they were not even aware about that they have got stroke, because within the golden hours they were not able to reach the disability rate. The disability that they have was more. If some of the survivors were able to reach within the golden hours, 1 or 2.5 hours. So the disability was much more controlled and they were able to be back on their legs and on the work after 6 or 7 months of rehabilitation. So this was a challenge. And second challenge, what I would like to present was in terms of the rehabilitation part. So the rehabilitation part was very crucial part, which many of the survivors and caregivers were not able to continue because of the financial problems. And that's why this disability gets so much triggered into their body, and they were not even able to come back as they were before stroke. I hope I was able to answer my question.
Thank you.
Okay, thank you so much, Tamana. Would you have anything to say or to kind of share with us in terms of quality of life of the patients and the caregiver, like in this kind of 2 years period?
Yes, definitely. So the quality of life is, if we will see the stories, everyone can see the stories that we have interviewed of our survivors on our website, that is strokesupportalliance.org. We have documented their stories also, and they have also written their stories on how they feel burdened after when they get stroke. Because the main head of the family, if that person gets strokes, the whole family gets, disrupted. The caregiver have to they have to lift their jobs to take care of the patient because of the quality of life they have. Because it's very crucial for the survivor to be, for the caregiver to be there with the survivor in every of the aspect of food, because they are totally bedridden for 6 months till they are or back on their chairs or back on their work. So yes, the quality of life is very much disrupted. Not only this, their mental health is the biggest issue that makes them back to their own lives. So the Stroke Support Alliance is just one of the patient group that have actually been able to, connect with each other and share their experiences on, and they have found that these mental health issues can actually be, decreased by this kind of support, by sharing and learning from their lived experiences.
Thank you so much. Like the point that you actually say is, the head of the household actually get affected. In fact, it's not only one patient, it's like the whole household turning into a huge burden.
Yes.
Really. So this is a huge issue. Do you really see, sorry, can I just ask one more question? Do you really see, with this, your initiative and the community at large change their awareness or kind of like social change? Do you see anything like that? Or it is only really merely within the patients and the caregiver?
So yes, there in community in large, we have seen that awareness is much more increasing from the past years, because if we see and we put up of all the data earlier, they were even, I just forgot to explain that 10 years back, my grandmother got stroke and she have 2 strokes and she is not able to now hear properly because of stroke. She has been impaired. So 10 years before, when I was too small, I was not even known that stroke comes out in the brain. I was thinking that stroke is related to heart. So we have seen this kind of an interpretation among the community side, that what actually stroke, where the stroke actually takes place. So in terms of the awareness, yes, there is very low awareness about the stroke, and there is very low awareness on when, if you will get a stroke and what post complications they might have and how to manage it. So yes, through this, what actually we have this initiative, we are trying to put all thing in the community. Yes, if you'll get stroke, there might be some complications. Just you have to think about the future on how to better manage these complications so as to, to get better back to your life. Because we have seen many of the survivors and caregivers who have actually recovered after the span of 5 years doing continuous rehabilitation and other activities that they actually considered under the rehab.
Samana, again, an amazing effort. And I think the fact that you're raising awareness in this way is so critical, because this is not something I think that is generally known in a sense to the wider community beyond, in a sense, the stroke patients themselves. Can I ask, you did touch on it in your presentation, but what is your assessment of the responsiveness of the policymakers that you've engaged across the different states in India? Have they been open to sort of responding and doing more to address the kind of issues that you've been able to raise? And the second thing is there a sort of component which is more preventive in a way? Because you mentioned there are cases, like even in your grandmother's case, where there's a second stroke. Is that kind of messaging coming through as well, both for the members of the network as well as for policymakers?
Yes, definitely. In terms of like when a person gets stroke, so what next? It's a question of a survivor. So they basically think that the stroke, we have got stroke, and then next it's like we'll never get stroke in our lifetime. So it's very important to make them aware that yes, you are actually having a comorbidity, because due to the several other comorbidity conditions like diabetes, hypertension leads to the stroke. If you'll not better manage it, you might lead to a second stroke. In terms of the policymakers and yes, there is an ease of building a constructive policy around that. Yes, has been working, because through our various regional and national consultation within a span of 1.5 years with different stakeholders from public and private sectors, they have come out with the issues and the challenges that actually when a patient is not able to reach within golden hour, and that's actually a biggest challenge for them. And that's why I have focused in my sustainability. That's very important, that we have to just find, just first thing is the awareness part, that the caregiver or maybe a stroke survivor should be aware that these are the BFAST protocols that needs to be first placed in terms of the awareness. And second, the first responders, the ambulance drivers, that actually we need to trained in how to better manage and how to make them reach into the nearest stroke ready hospital. So one of the pilot studies have also been studied by one of the advisors who is the part of our the stakeholders advisory board we have. So on this ambulance training of the ambulance drivers. So this is what actually we have seen right now.
Thank you, Tamana. Thank you for all the questions from the expert panel. So with that, let me hand it over back to Joy. So Joy, who is our next finalist?
Thank you for asking, Duo. Well, I'm pleased to say that our next finalist comes from my beloved country, the Philippines. So now I'd like to call on I Can Serve Foundation, represented by Ms. Cara Magsanok Alikpala, to present their initiative called Ating Dibdibin, which in English means Take Your Breast Care to Heart. Cara, the floor is yours.
Thank you, Joy. Thank you, everyone. I'm glad to be here. Thanks for inviting me to the jury. And thank you as well to my co-finalists and also to the other applicants. I'm sure everyone's project is a very worthy endeavor. So I'm from the I Can Serve Foundation. I'm a breast cancer survivor of almost 25 years. The mission of our foundation is to promote and conduct early breast cancer detection in local communities and provide sustained access to accurate diagnosis, timely treatments, and patient navigation. Next slide, please. So the project I'm going to talk about is Ating Dibdibin. In English, it's Take Your Breast Care to Heart, or Take Your Breast Health Seriously. This was launched in 2008. It still remains to be the only comprehensive community-based early detection program for any type of cancer in our country. It aims to encourage resource-challenged women to take charge of their health and to promote early diagnosis. It also aims to provide access to accurate diagnosis and timely treatments so many lives are saved. It's a partnership between our foundation and a city. We have 5 current city partners now. Next slide, please. The problem we are trying to address through this program is, number one, breast cancer is the #1 cancer in the Philippines. There is no national breast cancer screening program, no free mammography, no breast ultrasound to date, and government agencies and charity funding agencies are not consistent in the way they give money. There's still no medical access program for government up until 2011. The current government medical access programs only cater to those with early breast cancer stage. The problem is most of the poor have advanced breast cancer. In 2019, thankfully, the National Integrated Cancer Control Act was passed. In fact, our foundation was part of the coalition that lobbied for this law, but it's not yet fully implemented. So till then, we still have to continue what we want to accomplish. Next slide, please. This is how we implement Ating Dibdibin. We first make a pitch to the mayor of the city. We have to look for a champion. And then we tell the mayor that we only go through with the partnership if they agree to enshrine this program into a local law or an ordinance, so it remains permanent and it's assured of annual funding. We also do a needs assessment, and almost always we're starting from ground zero because no city really has its own breast cancer or breast care facilities or a program in place, and there's even no training. We also tell the city to assign a dedicated program team And I Can Serve connects the city to different partners who can help them create a patient pathway. So this can be a hospital, other facilities, social civic groups, patient groups, and anyone else who can help them. And then we also commission a research agency to do a pre-test and a post-test, so we know the attitudes and the behavior towards cancer and whatever breast cancer or breast care practices they may have in the locality. Next slide, please. We also train the community health workers, the nurses, the doctors on early breast cancer detection. These people I mentioned comprise the city health office. So we also teach them how to stage free clinics with forums. Although women who go to the community health center can get checked, we also encourage them to do like big organized free screenings. And all these screenings must accompany a forum. And in every forum, we tell them you must include a breast cancer survivor to give her testimonial, because she is automatically a walking piece of advertisement of hope. The doctors can tell you many things. Cancer is not a death sentence. You can survive this. But the mere presence of a survivor standing there already speaks of hope. We also select the best of the community health workers, or at least those who qualify, and train them to be patient navigators. Next slide, please. And then we have a big fiesta in the city to launch the program so everybody knows about it. We litter the city with posters, stickers on their public vehicles. City Hall really turns very festive to launch the program. So this is accompanied by a media campaign. And then after the training, we start staging the forums and clinics. We go from what we call a barangay or an administrative division. So for instance, one city has 28 barangays. So we and the city health go around staging these forums and clinics. And on the second round, we do the same thing, but this time the city partner executes a program and we merely shadow them. And then we do a graduation for the community health workers. Next slide, please. So far, this was what the results have been. Ating Dibdibin is still the only program in the country that utilizes community-based patient navigation for any disease. Most navigators are hospital-based, and most navigators in the country are nurses. It's only in our city partners where community health workers have been trained to become navigators. And this has raised the status of the community health workers because they were able to step up. In fact, when we asked the Philippine Cancer Society to train health workers to be navigators, they were saying, oh, this is going to be a problem. We can only train nurses. But then we said, please give them a chance, because this is our health center, our health care system is driven by community health workers, very few doctors, very few nurses. And so thankfully, they really stepped up. In the photo, in a pink shirt is a navigator. Her name is Marilyn. And on the other side is Gertrudes Calderon, a breast cancer patient. Gertrudes, when she was first diagnosed, refused any kind of treatment. She didn't want to get surgery. She said it felt like she was chasing after death, that the timer was clicking. So she didn't want to go on with treatments. But Marilyn was there and her team to really rally her on. And Gertrudes said the 4 magic words that was told to her was, "You are not alone." And that made her keep going. And so she successfully completed treatments after stage 3 breast cancer. She's now, in the picture, she's 60 years old. She's now almost 70 years old. And she's enjoying her 10 grandchildren. In fact, she's one of the founding members of the breast cancer patient group in the city where she's from, which is Taguig City. Next slide, please. Breast cancer now is being diagnosed at an earlier stage. The number of days between diagnosis and the first day of chemotherapy has been reduced from 10 months to 43 to 60 days on the average. Some city partners have actually made Ating Dibdibin a full-blown breast cancer program. Next slide, please. So far, we have trained 56 patient navigators and about 1,500 medical personnel. Of the 5 city partners, one has set up a breast cancer center, which is very admirable. One that is resource challenged set up a help desk, and another set up a breast clinic. Next slide, please. Community health workers are usually volunteers paid an honorarium. This is the case all around the country. But in Taguig City, one of our partners, they now have hired and pay full-time for navigators. And this is the first, and again, because their status has been elevated. In fact, when we train cities, we bring trained navigators from other cities to the other city partner, just so there's more interaction, they're inspired by each other. And in the last 2 years, during the pandemic, yes, a lot of things were on pause, but we were able to strike a fifth partner, and we were amazed that in 2 years, they were able at least to pass the local ordinance. We have to do more work with that city, including training, but that was accomplished. Next slide, please. So now more women do regular breast self-exam according to the post-test. More women go for screening. Less women are afraid of going to the doctors to see a suspicious breast lump, because they know the city's there to help them with the expenses and they know it's survivable. Next slide, please. So we would like to strengthen the program so it becomes more effective and reaches more cities. We plan to improve data collection and documentation through digitalization. That's why we need your help. We also need data analytics for screening and patient compliance and for better impact assessment. This is the weakness of the program. It's a very imperfect program. We also aim to have a central system that will provide stakeholders and decision makers with real-time insights on the project status. Next slide, please. So I don't have much time to show the campaign materials. I just wanted to say that when we started this program, it was a breast cancer screening program. Now it has become a full-blown breast cancer control program, no matter how imperfect. And once the program kicked in, it was easy for the city partners to realize that every step of the cancer continuum care is indivisible for the program to succeed. I give the highest credit to the city partners for sustaining this program. It's still the only program for cancer and perhaps for any disease in our country that's backed by a local law, which in a way assures its permanence and annual funding. Convincing the mayor to adopt the program is the easiest. Getting the buy-in of the city health office is the toughest. They perceive ating dibdibin at the get-go as added work, an added burden. But the moment they're able to improve the health of just one woman, that's when the transformation happens. They immediately feel rewarded for their hard work, embrace and own the program. Having said that, I also want to credit our volunteers at I Can Serve, who mostly have full-time day jobs. I realize that you cannot ask your partners to do something you are not willing to do. So it's important that the volunteers of I Can Serve, especially the leadership team, get down on their knees to work as hard as we expect the partners to perform. We hope you can consider our project so we can save the lives of homes, mothers and daughters, and yes, men too can get breast cancer. By saving more women, we keep families intact. We keep the heart of Filipino families beating. Thank you very much for allowing us to share our story of hope. I'm ready for questions.
Thank you, Cara. I really love your strategy and how you're able to involve the local city government. And guys in the audience, please, if you love Take Your Breast Care to heart, please don't forget to give them a heart. And now I'd like to call our expert panelists for the Q&A. Ching, would you like to go first?
Yeah, I think so. Like all the men are kind of like quiet right now, right? Hey, Cara, thank you very much. Very, very impressive, I'll say. I'd like to hear a little bit more about how's the buy-in from the doctors, the healthcare professional group in this campaign.
They're the hardest to please, the doctors, because when we come in, we are a patient group. Why are these patients teaching us? Why is the mayor deciding to spend for this group? They don't know anything. We've been to medical school and they haven't. But we tell them we put actually a medical team. It's not us training. We have doctors in the team. We have nurses. We have all kinds, multi-stakeholders to train them. So up until we're training, they're really not smiling, to be honest. They're really not happy about the program. But the moment they see someone's life improve, that's the only time they turn. So this is a common story among all our partners. When someone with a breast lump comes into them and they still don't have the program, they just say, oh, it's a breast lump, it's worrisome, go to a big public hospital, we can't deal with it. And almost always the story is they just find out that this woman dies without having visited that hospital. They always prefer to go to something that's in their neighborhood. So the moment they're able to just, improve the life of one woman, all of a sudden they improve. In fact, one doctor who just was really cursing at me during a meeting with the mayor, when we, 1 year later, we had a breast cancer campaign. he was on stage crying and thanking the I Can Serve Foundation. That's my most rewarding moment. But yes, it's not easy. The mayor is the easiest to please because it's, of course, making him or her look good.
Thank you. It is a very common issues among all the other patients group, I guess, on the work.
Ara, maybe I can come in and congratulate you. It's so well thought through, every aspect of this program, and so impressive in terms of sort of engaging the community health workers, engaging the city officials, as you say, the most difficult bit are really the healthcare professionals. And what I really like is your last point actually about the need for gathering data, because if it is to be expanded and made sustainable, that is your most powerful tool in a way, in terms of the objective evidence. But of course, what you say in terms of the emotional aspects, like the story of the doctor you talked about, is extremely important as well. How do you see this sort of moving on? Because you're thinking of spreading it around the Philippines more, but does the infrastructure actually facilitate this data gathering? And do you have any thoughts on how this might be sort of strengthened and addressed, because you're asking for support for this particular area? And what are the kind of gaps that currently exist that need to be addressed to sort of meet that point you raised?
I think, and I believe that a lot of the city partners realize the need for data, but there are resource challenge and it's the last priority. So they recognize. So just in the way we introduce the program, I think we need the grant to show them how it can be done. And once they see how it can be done and how successful it can be, I mean, how it can optimize performance on their end and make projections, make future plans that are more data driven, then they will embrace it. But we first have to spend and show them how it can be done. That's how you can usually convince them, proof of concept. And then hopefully they later on adopt this system that we may teach them. But again, we never really let go of a partner. We're always in touch with them, introducing them to what's the latest. We do joint programs together. We give them templates for campaigns, for whatever media campaigns. So it will be the same thing with this. We will be with them every step of the way. But again, I just wanted to say we really merely spark and fuel their dreams. In the end, they're the ones who really keep this program going.
Hi, Kara. Actually, I don't have questions, but I do want to share a little bit our experiences in China. We didn't do breast cancer promotion or education, but we did have some other desperate disease education. Actually, the largest enemy we are facing is misinformation and disinformation. I mean, the patient, they have access to receive the message, to receive the information, especially in China. They have WeChat, they have Weibo, all kinds of social media. And of course, they can receive the information for helping them to do some self-diagnosis or seeking for doctor's advice. But actually, there are a huge number of disinformation about disease, about desperate disease, especially tumor cancer. So I know this is very hard to do. So far we don't have a solution. I don't know how do you do this, but seems like in China we are still fighting with the misinformation and the disinformation. It is very difficult here.
This is the age of fake news. It's the age of fake news destroying democracy. So it is a problem. All you can do is really keep telling the truth. And just really bombarding people with the truth. So it's not, you don't even have to be intimidated by thinking of national programs, local programs, doctors. It's just even on the neighbor level, the women, they talk, they gossip. And if they have the right information, they travel information really fast. And if cities can really improve and, improve their lives and the quality of their lives, and that's the best way to battle fake news. So you just have to keep trying, really.
Thank you.
Thank you and good luck to us.
Is there any last questions from the panel, from Ching, from Professor John? If not, thank you so much, Kara. Thank you for sharing. And I'd like to invite back Duo to present our next finalist.
Thank you, Joy.
Thank you, Joy. Thanks, everyone. I definitely see the competition level is really high, and I know there are a lot of very excellent comments in the group chat. So keep them coming, keep the hearts coming. And then for the next initiative, so let's actually go all the way to Middle East, to Egypt specifically. And actually, these patient organization, they have 150,000 followers on Facebook. So let me invite Dr. Mata from Shifa ITP Advocacy Group. Over to you, Dr. Mata.
Hello, it is nice being in this very important meeting. My name is Dr. Mervat Matar. In collaboration with Dr. Doa Demirdash from Egypt, we are going to give you a briefing about our Stop Counting, Keep Living awareness campaign of ITP in Egypt. Immune thrombocytopenia is a rare platelet disorder. It is often overlooked and misunderstood due to lack of awareness and education, especially in Egypt. Patients are always afraid of recurrent bleeding episodes affecting work, physical activities, and even social life, such as marriage and giving birth to children. Society and caregivers in Egypt lack awareness regarding patients' needs. As a result, patients frequently feel isolated and alone. So what did we do? A few years back, we initiated Shifa, which means cure. This is the Egyptian ITP advocacy group, me, myself, and Dr. Doa Demirdash. And as you can see, we tried face-to-face meetings, but then with COVID, we started to do webinars on Facebook, and we started to screen short videos giving advice to our patients. Now we have more than 155,000 followers on Facebook on this account. We also created the Miss Platelets animation character to try to give advice to our patients, especially the young ones. But this was not enough. The society was not informed. There were always patients and caregivers, but society did not know about our ITP patients. So we needed to inaugurate the Egyptian ITP awareness campaign. That was back in September, included in the ITP Awareness Week. And Shifa kicked in. So what did we do? To address issues of social awareness and health literacy, we tried in line with Global ITP Awareness Week to launch a nationwide campaign in Egypt that would raise the profile of ITP in Egypt and remind patients that they are not alone. The campaign engaged all the senses, utilizing art and sports as vehicles to amplify the message and help in maximizing audience reach for the message. Through varied activities, the campaign was able to engage and diverse audiences, both young and old, from different governments in Egypt. We partnered with high-profile institutions and influential figures, allowing for both online and offline penetration, leveraging of the credibility to these entities and individuals to build further weight to the campaign. Remember, patients in Egypt and even society in Egypt is always attracted by the visual rather than by reading. And so we went visual and we went as public as possible to try to raise awareness for ITP in our society. So what did we do? We launched the Keep Living campaign. And please stop worrying about the platelet count. And we engaged in sports and in arts. Objectives: support patients living with ITP, raise awareness of the little-known disease, educate to support diagnosis and management, position Shifa as the patient's partner, support engagement and advocacy for ITP, and be included in the global narrative around Stop Counting, Keep Living for these patients. Let me show you. To deliver the right message to multiple audiences, we tried online and offline activities, activations, and events. We tried arts, we tried sports, we tried digital celebrities, we tried on-ground lighting and media. We did the works. Regarding arts, patients and even all the society, they enjoy music, they enjoy dancing. And so we went to the ballerinas of Cairo and we created the ITP song. We also started to look at sports. People are always involved in sports. And so we involved the most famous football club, the Ahli Club, and they supported us. And we also initiated a rowing parade in conjunction with the Egyptian rowing sports in Egypt. Digital celebrity endorsement, many celebrities were involved in our campaign, and they gave support to ITP patients, both on Facebook and on others. On-ground lighting, we lighted up one of the most famous medical schools in Egypt, where I worked, the Qasr Al-Aini Faculty of Medicine School, Cairo University, and we hit the media. Media was involved by press conferences and also by media and TV coverage, not only in Egypt, but all around the Arab world. We tried. Hopefully, we won. Let me show you.
ما تعبش، فكر في الفرحة، فكر في ازاي هتكون مبسوط، تتحرك اوعى تعيش مربوط.
Let me remind you that the color for ITP is purple, and so we are pushing purple, and we thank Pharma for endorsing us. And now I'm going to show you the ITP Awareness Rowing Parade, which we focused on the River Nile.
وكاميرا صحتك بالدنيا اتوجهت برضو لمؤتمر آخر في إطار الاستعداد لأسبوع التوعية بمرض APP والمعروف بمرض نقص الصفيحات الدموية المناعي. أقامت نوفارتس فارما بالتعاون مع جمعية شفاء ماراثون خيري بالتعاون مع كايرو رانرز، انطلق من أمام النادي الأهلي بالزمالك وتم إضاءة معالم شهيرة بالقاهرة باللون الأرجواني لدعم المرضى. نشوف التقرير وراجعين تاني.
احنا لدعم مرضى الاي تي بي او مرض نقص الصفائح الدمويه المناعي. ده مرض بيبقى في صوره يعني نوبات نزيف متكرره بتبقى تحت الجلد، زي نقط الناموس كده في اطراف الايد، او عرضه للنزيف من الانف او من الفم. وبعض السيدات بتلاحظ ان ممكن كميه او ايام الدوره الشهريه بتزيد.
So these are snapshots of the dancing, the Nile, the rowing, the balloons, everything. And all was covered by media. And so people were aware, the society was aware, and even celebrities were aware. Let me show you, these are many celebrities from Egypt. They're all well known in Egypt, all around the Arab world, and they supported ITP patients. Keep living, keep living. And this was our motto and still is. And this is a picture of the lighting up of Qasr Al-Aini School of Medicine, Cairo University, in purple, the color of ITP and the color of Shifa too. And that was shone all night long. We are proud of that. And also we had some international support from all around the world. They joined in because they enjoyed the campaign and they supported the campaign. And this was a real addition to us, an Egyptian campaign having international recognition. And we are going to keep at that all the way. So campaign success, I think it was a success. We had 67 pieces of coverage, reach outs, video views, estimated reach of almost 217 million all around the Arab world, posts and stories, participating celebrities, 55 of them, and also participating patients, including 2 celebrities with history of ITP. So I think we made it. It was a success. But can we stop at that? Do we need more? And the answer is yes. We need more patient engagement and caregiver support, especially the caregivers. We need to reach out to suburban areas in Egypt where the awareness of ITP and bleeding is not that much. And we lose patients over there because of the lack of support and the lack of awareness. We need continuous public awareness because we need the husbands, we need the fathers and the mothers and the sisters and the brothers and the colleagues at school to know about ITP cases and care for them and help them all around. And we need to address stakeholders and healthcare providers regarding patients' needs. This is very important because patients may be needing certain medications or certain care which is not available. We need to help policy shaping by showing the voice and sounding the voice of the patients that need to share in the shaping the policy of how to treat the patients in our country and all around the region. We also need to bridge the language gap between doctors and patients because the doctor jargon or the medical jargon needs to be explained to the patients patiently, consistently, repeatedly, so that they can take good care of themselves and good care of their families and can go to work, can go to school, and can enjoy life all around. And we need to engage patients all over the region, not just Egypt, because we are speaking Arabic and we have many participants at our Facebook account that are from outside Egypt. And now we need to take care of the whole Arab world, if possible, and engage with other ITP advocacy groups all around the Arab world and maybe all over the world. I need to thank Shifa, thank my patients, and thank my colleagues at the ITP clinic, Cairo University, for their help and support. And I need to show you, we celebrated the Egyptian Mother's Day a few days back, and my kids, they got me purple flowers, purple for ITP, and I support my patients all around. With that, I thank you.
Thank you, Dr. Marta. Very great sharing. I really believe in the power of partnership, which is actually at the core of the APPIS initiative and also the core of the Innovator program. And also I did see a couple of videos, although I don't speak Arabic, but I believe there are things that go beyond the language and words. And I also believe, as also mentioned by one of the speakers from yesterday, Carmen, so together we'll be awesome and together you'll win and we'll win. So I'm glad to have Dr. Marta join here live in a Q&A together with the expert panel. So I'm sure our expert panel have a lot of questions. And someone just told me, by the way, we have over 600 hearts from all the attendees so far. So that also actually reflects the level of presentation and also the great work of all the finalists so far. So over to you.
Thank you. Happy to be here. Very honored to be one of the 5 finalists. And I hope all will win. It is a pleasure and honor. I'm enjoying it very much. Enjoying the participation. And enjoying showing my passion to Shifa and to all my patients. They are not really my patients. We are work together. They are my partners. Thank you. I have to point out that we chose the rowing federation specifically because rowing can help ITP patients do sports without being bleeding, without friction. And so we have a dream of having one of the rowing boats specific for Shifa. And we will have the Shifa team, the rowing Shifa team, sponsored by the Egyptian Rowing Federation. And they are going to represent Shifa in all sport activities all around Egypt and maybe abroad. We will see. I'll let you know. And I'm happy also because we have now we have covered around 217 million people because with the press and the media, they went viral. They are not just local in Egypt, but they went viral all around the Arab world. And so this it really made me very, very happy. Thank you.
Thank you. Just a technical question. We all understand celebrity is very good for spreading information to attract public attention, but celebrity is also very hard to approach. So my question is, how do you approach these celebrities? Is it very costly? Is it very costly to approach the
Not at
celebrities?
all. Not at all. They all volunteered. They were all on Facebook, and as soon as they saw the campaign, they just volunteered their support. It was very
But how do you approach? You just send emails or messages to the through the Facebook, and they will say yes.
I think there's just some technical glitch. Dr. Mata, are you still there? Yeah, I know Dr. Mata is actually these days traveling within Egypt for a offsite conference, so she might be, encountering some, connection issues. But let's probably just wait for another 10 seconds.
I do believe approaching celebrity is a very good choice, but actually it is very expensive.
That's also true, the feasible part of the question. So probably here, I wonder whether Mei Ching or Professor Lim, do you have any comments or feedback regarding what you've just seen? And also, yeah, it would be great to also get your feedback.
Yeah, I just want to say that it's a very beautiful campaign and a very beautiful awareness, especially, like when you think about ITP, you think about bleeding, right? And then you think about, no, I cannot do this, I cannot do that, I cannot go sports, and all that. But she had put up a campaign of dancing, and rolling and all that. I think this is kind of like a very smart way to really bring awareness, because earlier on we talk about like how these days it's like a fake news or whatever, like people like to listen to something not traditional, I would say, if I could put it that way, Stanley. So it's like when you have something that is kind of like out of the expectation, then people start paying attention. So I personally feel that Shifa's beauty part is on this kind of like the smart way of like featuring sports and dancing and rolling. Yeah, I actually wanted to ask Dr. Matala, what is the most difficult piece in her campaign?
Yeah, I think that's a very great question. So probably what we can do is we do have this post-event networking session where actually we can meet everyone, including our lovely expert panels, our finalists, and also all the other patient community peers. And also we hope one day, hopefully soon, we can all go to Egypt, to go to the Nile River, to go rowing, and then there will be no connection issues then, I'm sure. So, so with that, probably Joy, I need to,
okay.
Just in time. I think Mei Ching just had a question for you, so maybe we can just spend the rest of the Q&A session for that question, if you're still with us here.
Dr. Mata, do you hear us? I think probably she has some difficulty on the technicality of the connection. Yeah, so probably for the interest of time, so we move to the next finalist. I'm sorry.
Maybe,
so Joy,
can I just add some comments as well? I just want to support. I was so overwhelmed by how creative and holistic this campaign is. I mean, I don't think I've ever seen a campaign quite like this, and it's got so much energy and life, which I think really brings across the point that ITP is something you can really live with. So it's really very creative, and kudos to Dr. Mata and Shefa for such a wonderful campaign and program. I suppose the only slight concern, it was also a question I wanted to ask, was, do people get so distracted by the celebrities and the events that in fact they might actually not catch the details of ITP itself and living with it? So I was just wondering how that sort of comes across in such an amazing campaign. So it was just a question maybe we can pose to Dr. Mata later as well. I think you're muted.
You're muted.
Okay, yeah, it would happen once at least. So with that, thanks, Professor Lim, for sharing your thoughts and questions. So with that, let me just invite Joy back and introduce our finalist of the day.
Thank you, Duo. And you know, even after more than 2 years of living in this virtual world, sometimes our technology still disappoints us. So now I'd like to call our last finalist, and I'm sure you're excited as I am to hear about the 5th initiative that made it to the finals. And pardon my bias, but I'm very happy to say again that this entry came from my beloved country, the Philippines. So now let me call Mr. Paul Mendoza to represent Psoriasis Philippines and present their program called Weekends with Sarfil. Paul, please take it away.
Hello, good day everyone. Welcome to Weekend with Sarfil. Good day, everyone. Welcome to Weekends with Sarfil. And my name is Paul Mendoza. I'm the president of Psoriasis Philippines, and I am here to share our program, how we engage with our members. Just to give a brief background, how Weekends with Sarfil started. We all know that during the pandemic, it is really a challenge for patients to access healthcare or even to visit their doctors. So a lot of our members has questions, what are we gonna do? Where do we gonna go? And where can we get this information that we need to take care of our condition? And that's why we started the Weekends with Sarfil. And during that time as well, a lot of our members felt that they were isolated and disconnected because of the lockdown and because of the restrictions in the city. So one day we decided that we have this social media channel, and why not just start a live video so that we can engage and connect with our members. So that's how Weekend with Sarfil started last January 2021. And for the challenges, again, there is a lot of misinformation about psoriatic disease and few reliable and accessible information channels. And many of our members are disconnected and depressed during the COVID-19 pandemic. And we also felt the need to have a platform where our members can connect with others and feel a sense of community and belongingness. And just a background, what is Weekends with Sarfil is all about. We also call it WWP. So this is a virtual education program where people living with psoriatic disease can access relevant topics about their condition. And it is a weekly program that has a wide range of topics, from medical facts about psoriatic disease to Weekends with Sarfil was launched last January 2021 and is aired every Friday, Saturday, and Sunday from 8 p.m. to 9:30 p.m. on Psoriasis Philippines Facebook fan page and Sarfil YouTube channel. So the objectives of this program is to create a project that would engage and connect with our members. Next is to provide accurate information about the full spectrum of psoriatic disease, comorbidities, and other related NCDs. And lastly, to establish a platform where other patient organizations can promote awareness about their condition and advocacy work. The program was broadcasted in our Facebook fan page and YouTube channel. And we tapped Sorfil members and developed their skills in hosting. Currently, we have a team for technical. We have program directors, we have program managers, and we have script writers every episode. And we trained them and boosted their confidence, which helped them cope with the social stigma and associated with psoriatic disease. And the program gave members the opportunity to interact with healthcare professionals, other patient organizations, and representatives of different sectors of the society. So one problem is, the question is, how can we connect with our doctors? So one of the strategy that we made is to create a platform where we bring in the professionals, the healthcare, the doctors, so that these patients can ask questions directly to these doctors on live. And another strategy that we do is that the program featured topics on psoriatic disease, mental health, non-communicable diseases, and other health-related topics, because we all know that psoriatic disease is not a skin condition, but a serious inflammatory systemic disease that can affect other organs or health systems in our body. And it's very important for patients with psoriatic disease to know that they should monitor their health to prevent and monitor these risk factors. And it also serves as a platform for other organizations to highlight their advocacy work and their disease, so that they can also create awareness of other conditions. So just to share the results for the first year that we've run Weekends with Sorfil, we had over 150 episodes for the whole year, and we had over 1.3 million views in Facebook and YouTube, and we had over 90,000 engagements in all episodes. And during that season 1, we featured 10 patient organizations and other civil society organizations. We featured over 20 health conditions and their advocacies. And the program is also serve as an educational forum on the provisions of House Bill number 9821, or the proposed National Psoriasis Care Act, and the venue to update members on the House of Representatives and approval of the bill and its transmittal to the Senate for concurrence. And I'm happy to say also that last January 3, we also have the Senate Bill number 2646, and we hope that this National Psoriasis Care Act will be able to lobby the support of the whole community. So here are some of the most viewed episodes that we have. So of course, we advocate them about disease, about psoriatic arthritis. We also featured the World Diabetes Day. And of course, as you've seen Cara before me, we also featured Breast Cancer Awareness Month. And we have the NCD advocacy in the Philippines. We also have the World Asian Spondyloarthritis. And we also featured the 3 presidents of Psoriasis Philippines, Philippine Dermatological Society, and Philippine Rheumatology Association. We also celebrated the National Disability Prevention and Rehabilitation Week. So we are part of the psychosocial and the orthopedic sector of persons with disability. The very pressing and important issue is about the COVID-19, the safety of the vaccines, and how can it affect psoriatic disease. So it's one of the most viewed and very helpful episode that we had. And we also had World Lung Cancer Day. And we also featured a social media influencer, which is Dr. Kiliman Guru, to share his heart why he is doing these live videos. So for sustainability, Weekends with Sorfil started. We already started it last March 12 for our season 2, and we intend to use the platform to increase the awareness of our members to rally for the enactment of the National Psoriasis Care Act, which will benefit more than 2 million Filipinos with psoriatic disease. We also would be inviting more patient organizations to utilize our platform to scale their advocacy campaigns and to create awareness of their conditions. We also intend to produce patient testimonials, videos to improve the public awareness of psoriatic disease. And for other patient organizations, if they wish to start their own kind of program like Weekends with Sorfil, we can also share our experiences and help them capacitate their organization or their volunteers how to start up or mount this kind of initiative using their own channels. And before I end, I just want to share the sneak preview of our season 2. If you could please share my video. All right. So again, thank you for listening, and we hope that you would also follow us in our YouTube channel and watch us every Saturday, 8 p.m. to 9:30 p.m. And if you wish to collaborate with us, feel free to contact me. Thank you, everyone.
Thank you, Paul. It's so amazing to see the huge community that you have built for psoriatic patients. And I found out that on the platform, we have over 1,500 hearts already. We've crossed the 1,000 mark. So guys, if you still want to share, give your hearts to Paul and to Psoriasis Philippines, you can still do so. Please keep on pressing and give as many hearts as you can. Don't be shy. We'll be counting your hearts. So let me call back our esteemed panelists now for the Q&A with Paul Mendoza. Hello again.
Hi.
Hello, Paul. Just a quick question. We all understand that psoriatic disease affects the patients not just physically, but also mentally. A lot of patients, they are afraid of going outside. They're afraid of wearing shorts, even in summer. So please tell us, how do you support these patients mentally? Thank you.
Yeah, thank you. That's one of the big issues because of the stigma, because we all know the premium that we give to the skin. And one of the things that we do, we really invite influencers who has psoriasis themselves. So they are very open and vocal about their condition. They even wear their swimsuits or even wear sleeveless or shorts, regardless of the lesions that they have on their body. And that's the thing that we want to show them, that it is okay for you to have this condition. It's something that you should not be shy about it. But of course, we can't help it. But it's a good thing that we can show that people are actually doing this, and they are okay doing it, and that the people around them understands and accepts their condition.
Okay, thank you.
Thank you so much, Paul. Hannah, it's wonderful, and stigma is a huge issue. I think not only in like the psoriasis patients group and also like the other among diseases. So just feel relaxed a little bit. My question is probably not directly, like to your project, but well, related as well. My question would be, if you are the winner of this project, what would the first thing that you would do?
We have so much plans to expand this Weekends with Sorfil.
Okay.
And one of the things that we are planning is to really do some videos that would showcase how it's like seeing a day in a life of a psoriatic patient, so that they will see some people, how they overcome this condition, how can they be successful at their work, how can they be successful in what they do. I think one of the important things is that we can show that psoriasis is nothing It's not something that should stop you from doing what you want or for reaching for your dreams or your goals. But it is something that we can overcome and be more productive in the society.
Thank you.
So Paul, let me add my congratulations as well. I mean, all the presentations have been so amazing. Let me just say something that I really like about this program. You've got the doctors engaged, so that closes the loop, as it were, on the kind of professional scientific issues. Secondly, you're addressing holistic issues like mental health and what you just described, so that people don't feel so sort of self-conscious. What was interesting, I noted, was that although this is a patient education initiative, you actually had significant health policy impact. You were able to get things through Parliament, which I think is quite amazing and wonderful. And your fourth thing, which I like, is that you are helping others and other sort of disease conditions and patient groups. Just one question, in a sense, I think, following up from Mei Ching's question, if you are going to expand, do you think there will be resource issues you have to face, both in terms of producing more sort of videos, getting more people on board? How are you going to sort of address this in terms of your own resourcing and team size?
Yeah, so one of the thing, if we get the funding for this, is to really duplicate ourselves. One thing that is important is that we are also focusing in our advocacy work. So it would be good to duplicate these volunteers, how to do the technical work, how to do the directing and the managing for the programs, and even for the hosting. It's also very important to get new hosts, to get new volunteer members, so that they can experience how to be on live. And I believe that being on screen also helps them to build their self-confidence. And yeah, I think that's the things that we were gonna do. It's very important to duplicate ourselves so that we can focus on other things and to expand on this project.
Thank you.
Thank you. Is there any final question for Rod? Sorry for not, not Rod, for Paul. Excuse me.
I think I just want to add something on the question of Mei Ching earlier. If we win, the first thing that we will do is that we will celebrate it in our episode this coming Saturday.
Yes, yes. I'm so happy that you actually said that, because I feel that advocates, like we the advocates, is already doing a very tough job, and living with the conditions not easy, and sometimes we forget to celebrate. And I think we need to also remember that let's live a beautiful life every day. So I think that is like the whole spirit of why we are here today, like not only on these best practices, but it's all the 3 days. So I see so many beautiful initiatives, hard work and all that. But guys, let's celebrate after this.
Yes.
And Paul, I think you really have a lot to celebrate. I mean, just on the platform, our hearts crossed 2,000 already. So I think you can expect that your audience, your listenership for Weekends with Sorfe will also grow by so much because of what you presented to us today. So I think it's been a great afternoon. It's been a great hour of listening to these fantastic initiatives. And now our expert panelists have the most difficult task of assessing and scoring. We do have an objective score sheet, but I'm sure it's still going to be quite painful to put the numbers down. But thank you so much to you, Paul, and to all of our finalists. It's been great, and congratulations already. It's been really job well done. So we will regroup. We will do the final assessments, and to everyone in the audience, please continue to watch this space as we announce the winner of the Innovator program in some time. So please, we'll keep you posted on that. So now, Duo, maybe we can have you back so you can let us know what's next for us for our summit.
Sure. Thanks, Joy. Thanks all the expert panel. And also, as Mei-Chi mentioned, let's celebrate not only for all the finalists and also for those, all the submissions and also the entire patient communities across the region for the great work they've been doing.